Hi, I'm Lisa, a registered nurse here with Precision Advanced Specialty Pharmacy. Today I'm going to demonstrate for you how we would do a 24-hour antibiotic infusion at home using the Elastomeric pump. We will see you in the hospital once we are being told that you are ready for discharge, and we will teach you how to do this in the home setting. When we see you, we will bring you a teaching sheet that looks just like this. This teaching sheet walks through the steps of how the infusion is done. It indicates for you exactly what supplies that you will need for your infusion. And there's a lot of other valuable information on the back side of our teaching sheet that will make doing your infusion in the home successful for you. We will also bring you one of our teaching mats. This provides you with a clean, dry surface to gather your supplies on when you're getting ready to do your infusion each day. Down the center of the mat, it just showed the steps, how the infusion is done. So it just backs up all of the steps for you when you're doing your infusion. And the first thing we're going to do is gather the supplies that we need for our infusion. So for the 24-hour elastomeric infusion, we will need to have one saline syringe. The saline syringe has a white cap on it. We need the actual medication. Your medication is either going to be a 125 cc ball like this one or a 240 cc ball like this one. The different medications and how it is prescribed for you will determine which one. So it could be either one of these. You also need an alcohol pad, and those are the three things that we need to start the 24-hour infusion. These balls will be delivered to you in a box. They will be on ice. They need to be maintained in the refrigerator, but they need to be brought to room temperature before they are infused. This ball takes 6 to 8 hours to come to room temperature. It's very important that it is at room temperature before it is attached to your IV line, because if the medication inside the ball is still cool or cold, the infusion will be too slow. So we want to make sure that it has ample time to come to room temperature. We recommend that you take these balls out of the refrigerator 6 to 8 hours before the time that your infusion is going to be started. So if we're going to attach our ball at 8 p.m. each night, then we would want to set the ball out of the refrigerator by 2 p.m. in the afternoon, between 12 noon and 2 p.m. No sooner than that, but no later than that. It needs to be 6 to 8 hours at room temperature. We want it to come to room temperature, but we don't want to sit it out at room temperature for longer than that amount of time. So we would set this out on a clean, dry surface, make sure that it is not in direct sunlight, and make sure that it's not reachable by small children or animals, because they think this is a toy and it could harm them. So just make sure it's set out up on a counter in a clean, dry area and out of sunlight. Now, when you take this ball out of the refrigerator, this tubing will have paper tape around it. You'll just take the paper tape off, spread the tubing out. The medication that is in this ball has been primed all the way down to the end of the tubing, so you do not have to worry about there being any air in the line. Each one of your medication balls will have a sticker on it. That sticker is going to say your name, the name of the medication, how long it takes the medication to infuse, and an expiration date. We do recommend that you confirm that it is your medication and it's the correct medication. You will not have to worry about it being expired, because our pharmacy will not make your medication until you're actually discharged from the hospital. So once I have confirmed it is the correct medication and it's my medication, and I've lengthened this tubing out, then I am ready to use my antibiotic ball. Now, anytime that I am going to get my supplies together for my infusion, or I'm going to be touching my IV line, I want to make sure that I have washed my hands really good with soap and water, and that I have put my gloves on. We will put the gloves in your supplies, so you will have those for your infusion process. Now let's go through the steps of attaching our 24-hour infusion to our line. The saline syringes have a white cap, like I told you, on the end. The side of them opens by tearing this perforated edge and then pulling our syringe out. Every syringe works the same way. The top just unscrews and lifts off, and then there is a little bit of pressure on the syringe and a little air in the top. We need to break that seal and get the air out before we use the syringe. We break the seal by taking our thumb, holding on to this lip right here and pushing up until we feel a pop, and then pulling down until we see drips come out the top. Once those drops come out the top, then we know there's no air in the syringe. We can set this down on our clean, dry surface, and the shape will prevent the tip from touching. We do want to make sure that we don't touch the tip of this because that's the part that will be connecting with our IV. So that is ready. So we have our alcohol, we have our syringe, and we have our 24-hour infusion. Now we're going to grab the end of our PICC line or our midline. Your line is going to have a hub just like this one. We recommend that you hold on to the fat part of the hub. It gives you a good area to hold on to. The hub of mine is white. Yours could be red, purple, pink, gray. If we put extensions on so that you can perform your infusion yourself, it will be white just like this one. But you want to hold the fat part when you're holding the end of the line. These orange swab caps are used to protect the end of our line so that in between infusions, or if the line is not used regularly, it protects the end. So we will take this off before we start this 24-hour infusion. None of the supplies that we use are reusable, so we will set that down because we're going to throw that away. Now, before starting any infusion, the first thing we want to do is clean the end of our line. So we're going to take our alcohol pad. We want to clean the end of the hub. These ridges here and the end are the part that we're looking to clean. We want to clean all around the sides and in the center. We want to do that for 10 to 15 seconds. And you want to put some pressure behind that. We call it scrubbing the hub. So we want to make sure you clean all around the sides and in the center 10 to 15 seconds. Once we have cleaned the end of the hub, we don't want to set the hub down because that would contaminate it. If we needed to do something and we had to set this down, just clean it again. You can never clean it too much. So to start our 24-hour infusion, the first thing we're going to do is flush it with our saline syringe. Inside the center of our hub is a spongy area. When we push against it with our syringe, you will see that it pushes inward. So we're going to take our syringe, push in the center, and then turn it to the right. So you push and turn to the right. This saline syringe is salt water, so the speed at which you flush this through your IV line doesn't matter. You don't have to go too slow or too fast. You just want to use a steady push. Whenever you are flushing an IV line, if you feel a great deal of resistance when you go to push on this and if it will not flush, don't force it. You'll need to call your home health nurse and let her know that when you tried to flush the end of your IV line that there was a great deal of resistance. If you have 2 lumens, you'll just use the second lumen for your infusion. For the 24-hour infusion, the ball is going to be attached to this line continuously, so it is unlikely that this line will get clogged because something is going to always be infusing through it. So we're going to go ahead and flush down all the way to the end. We want to push this black plunger down to this black line. I stop right at that black line just so if there's any air that is in the back side of this, we don't push that air in. Now we're going to unscrew. We will set that down because again, we're going to throw that away. We're going to pick up the end of our antibiotic ball. The antibiotic ball has this butterfly cap on the end of it, so we want to hold it so that we don't touch the end of the line. And we can unscrew the butterfly cap, just drop that down. You don't want to touch the end of this line because it is sterile. You attach the end of your antibiotic ball to the hub of your IV line the same way we did the syringe. We're going to push in and turn it to the right. So you push in and turn it to the right. We do want to make sure that this is snug, but not too snug that you can't get it off when you need to change it in 24 hours. You also do not want it to leak. So that's why we make sure it's good and snug. Now, once we attach the 24-hour ball to our line, the only thing we need to do now is open up this clamp. These clamps open by holding the back side and pushing the front forward. So just hold right here and push that forward. That makes it move, and then you'll know it's unclamped. Sometimes this clamp will leave a crimp in the IV tubing. So you want to make sure you push on that crimp and kind of roll it between your fingers, and you will know that that is open and this is infusing. Once I have attached this to my IV and I've unclamped this clamp, then this infusion has begun. Since it's a 24-hour infusion, it's going to take 24 hours for this medication to infuse. What you will notice over the 24-hour period is that this ball will get smaller and smaller until it is flat and empty. The inner core, which is white, of course, is going to remain there, but this fluid will all be gone, and if we started it at 8 p.m. one night, then at 8 p.m. the next night, it will be time to change. Now, when we get ready to change this, we're going to do those same steps that we did when we started it. We will want to make sure that we have a saline syringe. We'll make sure that we have an alcohol pad and that we have a new 24-hour ball to attach. So at the end of the 24-hour period, this infusion will be complete. The ball will be flat and empty, and we'll be ready to attach the next day's infusion. Again, we want to make sure that we pick a time that works best for our schedule so that each day when you need to change it, it'll be convenient for you. So when I get ready to change this ball, I'm going to, again, make sure my hands are washed and I put my gloves on. Clamp this ball off. You're going to hold the hub, unscrew the old 24-hour infusion. Remember, we don't reuse anything, so this will go in the trash. We're going to take an alcohol. We're going to clean the end of our hub again, all around the sides and in the center for 10 to 15 seconds. We will have our saline syringe ready to flush before we attach the new 24-hour infusion. Just unscrew the white cap, lift it off. Break the seal by taking your thumb, push up till you feel a pop, then pull down until you see the drips come out the top. Now I attach it just like I did before, press in and turn it to the right. I'm going to push this black plunger all the way down to this black line. Unscrew this ball. Now we have our next 24-hour infusion to attach. I'm going to unscrew the butterfly cap, attach the IV line to my IV hub, screw that to the right. Then you will open up the end of your clamp just like we did before. Hold here, push forward. Make sure you press on that crimp, roll that in your fingers so that that is infusing. Remember that this is your pump for your medication ball. So this doesn't have to be elevated in the air. It doesn't have to be attached to any type of IV pole or an electric pump. This pump does the infusion process for you. So this can sit beside you in the chair. It can sit beside you on the bed, but it also is made so that you can be mobile when you are at home. We will provide you with a fanny pack that looks just like this. This way you can put your infusion ball inside the fanny pack, and the fanny pack can be tied around your waist, or you can hold it on your shoulder. Most patients put it on their waist. If we attach our fanny pack to our waist, then it makes it easy for us to carry our 24-hour infusion with us and it not get in our way. You can do your normal daily routine and the infusion will still be going 24/7. I do recommend that you attach your infusion and run it through your clothing so that all of this tubing is underneath your clothing rather than it being exposed. So if your IV line is here in your left arm, then you will want to make sure that you run this tubing up through your shirt and then down through the bottom of your shirt. So the ball will come out at the bottom of your shirt and you'll be able to put it into your bag. The tubing will be protected underneath your clothing and you will not have to worry about it getting snagged on something or pulled out. It will also keep it, if you have animals or small children in the home, this tubing will be running up through your clothing and so nothing will be exposed. So that's the easy way for you to carry it with you at all times. Just have your fanny pack around your waist and the tubing running through your clothing. Now the other thing I do want to show you is a lot of times when you're getting a home infusion, you will have a IV line that has 2 lumens to it. Since our 24-hour infusion is attached all the time, that second lumen will need to be flushed every 24 hours. Now to flush that second lumen, I need 1 saline syringe with the white cap, 1 heparinized saline syringe with the yellow cap, and 1 orange swab cap, and then I need an alcohol pad. These syringes are going to open just like the others. Take that off, unscrew the top, take my thumb, push up till I feel a pop, then pull down until I see the drips come out the top. I'm going to open up the heparinized saline. The heparinized saline is a small amount of heparin that is mixed with saline or salt water. It is used as the last thing that you flush through the lumen of your line at the end of an infusion or through a line that's not being used regularly. This stays in the lumen of the line and keeps it from clogging. Because it is a small amount of heparin, heparin is a blood thinner, but that amount of heparin that is in this syringe is very tiny, so it does not affect your medication and it does not thin your blood. So this top unscrews the same way. We take our thumb and to break the seal, we're going to push up. There's half the volume in this syringe in comparison to the saline. So when you break the seal, it does take a little bit more push to push that syringe upward. Then we're going to pull down until we see those drips come out the top. So now we have what we need to flush our second lumen. We're going to pretend like this is our second lumen of our IV line. More than likely, since this lumen is not being used regularly, it's going to have an orange swab cap on the end. So you'll take the old orange swab cap off. We don't reuse those, so we'll throw that in the trash. You're going to clean the end of the line, just like we did before, all around the sides and in the center, 10 to 15 seconds. Take your saline syringe, attach, push it inward and turn to the right. Then we're going to steadily just push the saline. Again, the speed is not important. It's not going to hurt us. We're going to stop right here at this black line. We'll take the heparinized saline syringe, push that inward and turn to the right. This black plunger, we want to push down to this black line. If you happen to be a pediatric patient, the heparinized saline syringe will not be yellow, it will be blue. We're going to stop there at that black line and then we unscrew this. We're going to get our new orange swab cap. The top of this just tears open. You don't want to touch the center because there's a wet alcohol pad in the center. We're going to take the end of our hub, push it into that wet alcohol pad and turn it to the right. And then the packaging will come right off the top. So we have a new orange swab cap on the end of our unused IV lumen, and that will stay there until we change it again in 24 hours. Since you are going to be changing your antibiotic ball in 24 hours, you can flush and put a new cap on the unused lumen at the same time. So that is how you perform a 24-hour elastomeric antibiotic infusion in the home.